started recording.
Miss Traylor.
Yes.
Did you get that Paige was here? I just got disconnected.
I did not. All right. So Paige and Isabella. And it's 12:05. So if anybody else gets on, just make sure that y'all type it in the chat. All right. Slide 17. Where you at? All right, so now we are going to talk about patient education. I am incredibly passionate about patient education because we're that gap that fills, we fill that gap for our patients. So physicians have the knowledge and they prescribe these meds and they, you know, they give them to our patients appropriately, but we're really the people that educate them and make sure that they're being compliant and encourage them. So most people, generally speaking, what do y'all think? Is this still chapter 4? I'm pretty sure. Let me look and see. They're kind of all melded together. This is kind of going to be more leaning towards chapter 5. But it'll throw a little bit of chapter 4 in there too, because it's kind of all intertwined, but mostly chapter 5 today. So what do y'all think? Type it in the chat what y'all think across the United States a general reading level is. Like, what do y'all think is the, I guess, kind of the what we follow in regards to education? Like, what grade level do people comprehend on? Elementary, 8th grade. What else y'all got? 7th, 5th, 9th, 10th. Okay, so what do you guys, middle school, 7th? Okay, so y'all, most of y'all kind of have the right idea. When we're educating our patients, now we never want to talk down to them like they're not knowledgeable. We don't want to be condescending, but we don't want to use words that, you know, that people in lay, like, okay, so my dad, let's reverse a little bit. My dad's a pretty educated man. I mean, he graduated high school, he didn't go to college, but when I start talking about nursey things, he says, you got to stop all that nurse talk. You can't talk all that nurse talk. Just tell me the facts. Like, they don't want all of those words that we use to describe things. They just want to know why they're taking it. And then you're going to have other people who want all of the details. So your job is going to be to feel out and assess what their needs are and what their education level is so that you can educate accordingly. But across the United States, 5th grade is generally the reading level that most education type things are printed towards, you know, that reading level. So that's something that we're going to keep in mind when we're educating our patients, okay? So teaching is an interactive process that promotes learning. So am I teaching if everybody that I am talking to is checked out? That is not teaching, that's just me talking, okay? So if your patient is checked out, then you're not educating, you're just talking. That's why I try to talk to y'all and make you type stuff in the chat bar, because if you're not communicating with me and you're not actively listening, then I'm not truly teaching. So learning is a patient acquiring new skills or knowledge. So as a nurse, I already said this, but we should motivate the patient and encourage patient participation. And so y'all probably know this, but there are 3 domains of learning: cognitive, affective, and psychomotor. So those can be found, let's see, just trying to give you the corresponding pages. Okay, on page 54, box 5-2, it talks about the domains of learning. More important than that is the learning style of your patient, but let's talk about those domains first. So the cognitive domain is the intellectual activities such as thought, recall, decision-making, drawing conclusions. In this domain, the patient uses previous experiences, prior knowledge, and perceptions to give meaning to the new information. So that's kind of like when you tell a patient something And who asked me something yesterday? I'm trying to think. And they say, oh, is that kind of like such and such? They are relating that to another thought that they have to make it make sense in their head. That's the cognitive domain. The affective domain includes the attitudes, feelings, beliefs, and opinions of the caregiver. So I can be listening to you, but if I don't believe what you're saying, if y'all thought that I was not, I hope y'all think I'm knowledgeable. If y'all thought that I was a big dummy in regards to pharmacology, would you listen to what I have to say? If your feelings towards me were she is an idiot, would you listen to what I had to say? You wouldn't. You would check out. So not only do we have to have that cognitive domain, we have to have that affective domain. And then the psychomotor involves learning skills or tasks that, excuse me, learning physical skills or tasks. So what is an example of a physical skill that your patient might have to do? In regards to medication, taking meds. So walking is a physical skill, yes, but I was talking about in regards to medication. So yes, injections. So yes, walking is a physical skill. So if you're teaching somebody, how to walk, that is within their psychomotor domain. So y'all aren't wrong. I just wasn't specific with my question. But when we're reteaching patients how to walk who have had strokes, not only do they have to understand, they have to be able to, have those psychomotor skills as well. So like giving an injection, applying ointments, those are things, if your patient, and I'm not being funny and I'm not making fun, I don't want y'all to think that. If your patient has a lesion on this arm and they're paralyzed on this arm, and you're going on and on and on about how to put an ointment on this arm, how are they going to do it? Is that possible? Not at all. So you're educating the wrong person. You need to be telling them, do you have someone that can apply this ointment? If you're completely disregarding the fact that they can't move their left arm and can y'all see me or no? Okay. And you're disregarding the fact that, yes, it's not that difficult to do this. But if the arm that you need to do that with is paralyzed, then we don't have the psychomotor domain to even do that. So those things you have to take into consideration. The affective domain, how last semester we talked about therapeutic communication? If you are talking to your patient like they're not very smart, or you're talking to them like it is an inconvenience for you to educate them, they're not going to listen. Their feelings towards you, like I said earlier, they're not going to be able to, they're just not going to listen. They're not going to learn. They might hear you, but they're not going to learn. And so as far as learning styles, did y'all do any exercises last semester to determine what type of learner you were? Like if you were auditory, kinesthetic?
No.
Okay, cool. We'll do that. I don't know if I have an exercise. Maybe on the break I'll try to find one. Because it's good to know what type of learner you are. A lot of us are kind of intertwined in all of those things, but most people are not auditory learners. Therefore, when you just tell them things, what happens? It goes in one ear and it goes out the other. So you have to kind of bring in all of those things. You have to bring in the visual, the auditory, and the kinesthetic aspects of education, so that we can reach all of our audiences. So I'll try to find that when we're on a break. So best learning occurs with inner motivation. So like I talked about, you guys are all able to learn because y'all are invested in this class, because y'all want to be nurses. It really has nothing to do with probably even caring about pharmacology, because who really, really is passionate about pharmacology? I'm feeling like it's 0 out of 26. I don't know, but raise your hand if you're passionate about pharmacology, other than Miss Traylor. Oh, look at there. Some people Macy says she's a little bit interested, so that's good. Go Macy. I'm glad I got a little fellow person on the way. when I was in school, I hated pharmacology, but I really wanted to be a nurse. So that was my inner motivation. So your patient's inner motivations, it might be that they want to watch their children grow up. So they're not interested in giving themselves an insulin injection, but they know by doing that, they're protecting their health, and the fact that they want to be here for their babies, that motivates them, okay? I went to a yearly appointment the other day that I haven't been to in 5 years, but I know that I need to do that to take care of my family and to take care of myself. So finding your patient's inner motivation is important. Across the board, generally speaking, most adults are visual learners. That's why doing this online is difficult for a lot of people, because they're not able to touch and associate me moving around and, me pointing to stuff and all of that. And then all three domains of learning help to evaluate teaching effectiveness. So I said that their learning styles are more important. That's not really true. They're equally important. They all go together, okay? Questions, comments, confusions. Funny story real quick. And it's gonna sound like I'm never making fun of anybody. I just want y'all to understand these things, okay? So my husband, pretty healthy guy, until about a little over a year ago. He woke me up one morning and he was like, Brittany, I think something's wrong with my heart. And I'm like, normally I would be like, whatever, you're fine. But I checked his pulse and something was wrong with his heart. So we went to the emergency room. And his heart rate was really, really rapid. His heart rate was like 178 and he was in AFib. So he was 34 years old with a brand new diagnosis of AFib. So he went from not taking any medications except for an occasional spray. It came to educate. So how do you think that he, whoops. Let's see. Okay, am I back? Okay. Did y'all hear any of my story, or do I need to start over?
Last thing I heard was that he had AFib, and that was it.
Okay. So he had AFib. Okay, start over. I'll start over. So my husband woke me up one morning and he said that something was wrong with his heart. And so I checked his pulse and it was extremely elevated. It was 170, very irregular. So we went to the ER and he had AFib. So because of that new diagnosis, he was placed on a blood thinner. And he was also placed on a high dose medication for his heart arrhythmia, okay? So he went from no meds to taking these new meds, and he had never heard of them, and he was just totally overwhelmed. So first of all, do you think that he was in the headspace to learn anything in that initial diagnosis? Is that the time to teach? No. When someone is like, whoa, they need a minute, right? So you don't want to just start saying, blah, 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 blah. He had to absorb a little bit. He had to absorb what AFib was. He had to absorb, I'm going to be in the hospital for a week and potentially miss X amount of work when I'm the provider for my family. So initially, what would y'all say? Let's go back to yesterday. Initially, what would his diagnosis be as related, not as related to his heart, but as related to medication administration? What would that diagnosis be? You could type it in the chat. Yes. So anxiety. So he had anxiety related to his new health condition, okay? And then he also had that deficit knowledge of those meds, right? Everybody understands that? So this sweet little man came in. He was the pharmacist at the hospital. And he came in to educate John on his meds. And he started talking, and he's like, your new med, and he had an accent. So on top of John being overwhelmed, he was trying to focus on someone whose language wasn't the primary language that he had. Let's see, Macy. So deficit knowledge related to anxiety would be an appropriate diagnosis for him. Yes. It would be as evidenced by anxiety related to a new health condition, but we'll go into all that later. But yes, deficient knowledge or deficient knowledge could be one nursing diagnosis, or anxiety could be a second nursing diagnosis. I would take either of those if I asked you that kind of question. So I forgot what I was saying. So this man, I don't know where he was from. He had a precious little accent that even I had difficulty understanding. So he came in and he started talking to John and he said, I'm here to tell you about all of your medications. And he's going on and on. He's like, and it could cause bleeding. And if you have a job that you will not be able to climb ladder, you will not be able to get, to be in high spaces because it causes bleeding up the gum, bleeding up, blah, 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 blah. And he said, it will cause bruising, it will cause your gums to bleed, it will cause blood in the stool, You look for all those things, but it's just like water. If you drink water, there's a risk with drinking water. So that's okay. So he left out of the room, precious, educated beautifully. He left out of the room, and my husband looked at me and he said, so I can't drink water? That is all he heard. That is all he heard. Was that he couldn't climb ladders and he couldn't drink water. Well, he's a contractor, so he climbs ladders for a living, and he does scaffolding. He's on scaffolds all the time. So what do you think happened to do you think that he was properly educated in that moment? Do you think that it was really the fault of the person who was educating him? What do you think, what domain was off? Like what was the problem before education even began? So do you think that there was an issue in the cognitive domain? Like he wasn't smart enough to understand what he was saying? Do you think it was his attitudes, feelings, beliefs, or opinions, or psychomotor? It was a little bit of both. Not psychomotor, because he's totally able to take medications, but cognitively, his thought process was not able to put all this together. It was just too much going on. And on top of that, from the affective domain, he was anxious. So we could kind of go either way with those, but just know all of that to say your patients have to be in the right headspace to hear what you're saying. It's not just your job to go through all of those things. And they won't always recall it the first time. That's why we reiterate and reiterate and reiterate. And then we give them a pamphlet to take home with them, okay? They're going to go, and that's why we're going to do all those things. So we're going to verbally tell them. We're going to have them go through the motions if they can. We're going to have a family member present if that's possible, and then we're going to give them written paperwork. Y'all see how that puts it all together? Because they can read that written paperwork when they're in the right headspace. They can talk it out with their family, and we can ensure that they have the psychomotor ability to carry out said thing. So by the next day, once he had absorbed everything, he read the paperwork. He was like, oh, so I'm only going to bleed if if there's a complication, like I can still do X, Y, Z. And I'm like, yeah, And so then the doctor came in and he's like, he told me that I couldn't climb ladders, but I climb ladders for a living. And so, the doctor talked to him about risk versus benefit. And, while that's not ideal, if that's how you have to make a living, these are just the risk, and we're just informing you of those risks. And so he was like, okay, I got it, cool. Was he still a little anxious about being on new medications? Yeah, but did he understand what was being told to him? He did. So that's your job. You can't take away all of that anxiety, but you can ensure that all of those things are in place to better educate your patients. That was a really long story to tell you all that. I'm sorry. Okay. So it's an essential task. A relationship must be established. So we've kind of talked about that too. Think about the pharmacist coming in who he had never laid eyes on, who really was the best person to educate him, but it wasn't someone he had been communicating with. It wasn't someone who had built that relationship with him yet. We need to supply the patient with information and evaluate understanding, mutual trust and respect. So nurses who understand the changing healthcare system and practice good health communication skills can empower patients, resulting in better outcomes. So that is your ultimate goal in regards to education. Assessment and intervention are necessary to enhance health literacy. Health literacy is the term of the day. You need to know what it means. And we're going to talk a whole lot about health literacy, okay? Does anybody have any guesses as to what it means? Yes. So being able to understand health information and being able to apply it or use it. So box 5.1 on page 53 is incredibly important. So I would say, I didn't even really tell y'all about my background for the people that I didn't teach last semester. It's on page 53, the bottom box on the left-hand side, box 5.1. So my favorite type of nursing is hospice nursing. If I didn't teach you last semester, I think everybody else knows that. And hospice primarily is education. It's education, educating on the medications that we're giving these patients at the end of life, and educating on the death and dying process. It's just supporting, educating, reiterating over and over again, basically until death. So, so understanding limited health literacy is just so important, especially if you are in a role like that where you're going to be educating a lot of people, okay? So I know y'all probably already looked at the book, but do you know someone who has learning disabilities? You don't have to tell me what they are, but does everybody know somebody who either has ADHD or dyslexia or I can't even think, there's about 100 million learning disabilities. So I'm not really seeing any no's. Okay, so we would all agree that we know someone with a learning disability, or we know someone that knows someone with a learning disability. Do any of you guys know anyone that's hard of hearing? Hey, I'm going to exit out of my PowerPoint for a minute because I want to see y'all. I don't want to look at the chat anymore because most of this is just going to be talking it out. Okay, so we pretty much all know somebody. Okay, does anybody not know anybody that's elderly? We all know somebody that's elderly, right? Okay, we all, anybody know anybody with low income? Because I'm over here waiting for my tax check. I'm just kidding. I am not kidding, but so does everybody know somebody with who sometimes lives paycheck to paycheck, or is worried about their lights getting cut off? Or these are not uncommon things, y'all. These are things that we live with every single day. All of the people that I mentioned, they might have limited health literacy, not because they're dumb, but because they have so many other things that are going on in their life, okay? People with low income, they're often going to choose to pay their bills before they get their medication, okay? That's a reality in the world that we live in. People who speak different languages than us, people who are unemployed. So these are not, okay, so these people, they might have medical forms that are incomplete or inaccurate. Is our response, oh my God, I can't believe I'm so tired of these people not filling out their forms correctly? Is it annoying when people don't do what you say? It's kind of annoying. Is that the right response? No, it's not. Frequently missing appointments, same thing. That patient that missed their appointment, what's the reason other than not wanting to miss their appointment for missing an appointment? You can type those in the chat, or you can tell me. Y'all can talk to me. Work. Some people got to work. That's right. What else? Yep. Child is sick, no ride. Transportation is a huge issue in our, in the world that we live in. So, the same way that we tell you guys School is a priority. I need you to be at school. I need you to be here. I need you to log on. It is a priority. And I mean that with all my heart. But y'all all have those same things going on in your life too, right? So you have to put yourself in your patient's shoes in regards to when you're educating them, kind of being like, I do recognize, let me give you some resources for transportation. Or let's see if we can get you with the social worker and see if there's any, instead of just saying, forget it, he doesn't listen, he doesn't take his meds, he doesn't care, because the root of it is not always they don't care, okay? So groups with higher health literacy include elderly, low income, US born, but they speak English as a second language, deaf or hard of hearing, people who did not finish high school, the learning disabled, immigrants, and the unemployed. Those are kind of your group of people that are going to have the lowest or limited, not necessarily the lowest, but limited health literacy. And those behaviors go hand in hand, like we talked about. Medical forms being incomplete, frequently missed appointments, not following the medication directions. Can't tell you guys how many times I had to make very elementary like charts for my patients that said because sometimes you give meds 3 times a day. But when a medication is, you can give this one every 2 hours, and you can give this one, especially, in hospice when everything is scattered and all 6 meds are brand new, making a chart that says, these are the times you can give this med, and you put a little check mark there when you give it. Or, making them some kind of little tools that they can keep track of. But not following medication directions is a huge sign of health, having limited health literacy. Having the inability to name or give the purpose of your meds, the inability to describe how to take their meds, and they verbally say that they're taking their medications, but their labs are just worsening and worsening and worsening every month. All of those are signs of limited health literacy. And it's our job to identify these patients and assist these patients and educate and build a relationship with these patients, okay? You can tell I care a lot about that. I know I talked a long time. So you probably already read it. How many people in the United States do you think have limited health literacy? What percentage? So y'all are actually a little bit high, but I would rather you be high than be low. So 1/3, 33% have limited health literacy. Now that doesn't mean that, and I didn't want to confuse y'all either. Just because someone is struggling to pay their bills doesn't mean that they have limited health literacy, but those are just factors that go into that. Does that kind of make sense? So I don't want y'all to see that as the exact same thing. I just kind of wanted to use that as a tool to make you recognize, that we know these people in our life. But actual limited health literacy is it's not the same thing as just those individual things that I said. Let's see. So using simple and clear language will help people understand. People who are highly literate can have problems understanding language use in healthcare. So even our people who are educated, I'm going to use you as an example, Paige. Paige has a previous degree, and correct me if I'm wrong. Paige has a previous degree in a different field of study. Does nursing come easy to you right off the bat? Does everything make sense?
No.
Just because just because you're educated. She was an educator, but that doesn't make all of this make sense to her, right? So your patients are going to be the same way. I can remember when I was pregnant, same kind of thing. I would go to OB. Yeah, I was a nurse. I didn't know nothing about babies. I didn't know nothing. So we can't just assume that because it's the flip side of the coin too, that because our patients are educated, that they understand everything they're picking up what we're putting down, because that's not true either. So up to 80% of patients forget instructions spoken to them. Of those who say they recall the instructions, only 50% of them get it right. So that is why it's important to have a secondary means, you know, to make sure that we're giving those handouts and everything. Let's see. Also, limiting the amount of information at each interaction with a patient. Small little bite-sized pieces of information are better. Let them absorb a little bit and then give them a little bit more, okay? I know none of this is brand new information, but I just really do want y'all to understand how important it is. Okay, let me go back to my PowerPoint. I want to see some faces that I don't see. Zoe, Ashlyn, I can't see y'all. Let's see who else I got. I don't know. And everybody's not showing up at the same time. Somebody's got their hand up. Hold, please. Let's see. Opal, you got your hand up? Or was it an accident?
Accident.
Okay. All right, I guess I'm gonna share my screen again. Everybody's good? This is easy stuff. This is good stuff. Oh. All right. All right, so nurses must have cultural competency. So that's something that's important. Recognizing different cultures and different belief systems that y'all learned in foundations, those are truly important in regards to some cultures believe that women should endure pain. Therefore, painkillers are frowned upon. You know, so you might be on your end saying, we need to take it because, you know, it'll help your pain and da 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 da. And then, you know, the culture that's, you know, not bred, but the culture that's instilled in that person, you know, is saying, no, you can handle this. You know, you need to be tough. You need to be strong. You need to bear this. And so what's going on then? You have an internal conflict with how your patient feels and what they're being told. The same is very true with anxiety medications. You know, people who are spiritual have a hard time letting go control sometimes and taking medications for anxiety or depression. And that goes cross-cultural. You know, there's so many different cultures, and we need to be competent of those feelings and those practices so that we can be empathetic to how they feel, you know, and what's, you know, explore those thought processes, and not only explore those thought processes, respect them. Even like, you know, blood is you know, when we give blood, we're going to talk a lot more about that in IV therapy, but, you know, Jehovah's Witnesses are against giving blood, against receiving blood. That is not that's not for us to say, well, that's silly, you know, that you would rather lose your life. That's not for us to say. It's only for us to educate how the blood would be beneficial and then to respect their wishes. Same way if they refuse their meds, it's all the same. And then providing resources for those with limited English proficiency. So if there needs to be a translator present, then you need to use the translator service. Just making sure all of this goes into assessments. Assessing your patient's needs. If you can assess their needs, then you can, in turn, you know, provide what they need. When we're teaching the adult learner, we need to have them demonstrate the technique. Supervise, we need to supervise the practice. We need to help them get ready, and then we need to allow them to perform the task. So I know that I really want to jump in. If somebody's struggling, I really want to like jump in and take over and do it for them, right? But when we're teaching somebody to do something and they're going to need to be doing it independently, we need to be patient and let them kind of struggle through it a little bit and offer assistance where needed. but we want them to be able to do these things independently when they're discharged. So this is mainly, I'm specifically talking about like injections and that sort of thing when we're teaching patients to give insulin and that kind of stuff. All right. So using the nursing model for medication education, this is pretty much just an overview of putting chapter 4 and chapter 5 together. We're going to gather data. We're going to develop an effective teaching plan. We're going to assess their learning ability and determine the purpose of assessment. So what is our, what are we doing all of this for? Are we gathering all the pieces of the puzzle that we need to move forward? For diagnosis, effective individual therapeutic regimen or ineffective therapeutic regimen, deficit knowledge, we talked about all of those things already. Planning is when we're actually developing these strategies and individualizing the teaching plan to our patient. When we're implementing, we're going through the motions, we're doing something, where there's action taking place and we're educating. And then evaluation, we're evaluating their knowledge. Were they able to? Were they not able to comprehend, to perform the skill, et cetera, et cetera, et cetera. Okay. All right. How are we doing? Still pretty easy stuff, right? We're still okay, everybody's good? Okay, none of this sounds foreign, it shouldn't. All right, so what I want to do really quick is y'all want to do some role play or not really? You want me to be the patient? Somebody could be the nurse? Yay, nay. Okay. Do the people that said yes want to be my patient? Macy, you were the first one to say yes. All right. So you will be the patient. All right. So, I'm going to go back. So you can unmute yourself. We'll go back and forth, and I will. I need y'all to be listening and identify some things that I did wrong as the nurse and some things that I did right as the nurse. Okay. All right. You ready, Macy? Where you at? I can't see your face.
I'm ready.
I can't see you.
Sorry, y'all.
Well, I have a headband on. I look like a child today. So it's okay. Except for the big gray spot you can see right there. I tried to cover it up with my headband, but it didn't work so well. Okay. I still can't see you, Macy. That's okay. I'll pretend like I can. You might have your camera on, but it
like pop up like once you start talking, it usually pops the person up that's talking. I don't know.
Yeah, I don't know. Oh, there you are. There you are. It might have just been delayed. Okay. So, hey, Macy. I'm your nurse again today. How you doing?
I'm good. How are you?
I'm good. You ready to go home?
I am very ready.
I got some brand new medications for you. I'm going to tell you all about them. You ready?
I am.
All right. I got you. We're going to give you some, you're going to go home with this Flagyl, 500 milligrams TID. You're going to take this. You're going to do that for 10 days. When you're done with that, you need to return to the doctor's office, and you're going to be just whenever, if you feel any symptoms or whatever, just come on back. We'll take care of that. And then we have their acetaminophen. We're going to give you that, as needed. Just take it every 4 hours per the package instructions. I also have here some, you can use this, this probiotic. You need to take that for your stomach. Don't forget to take that. It's really important. If you don't take that, you're going to wish you did. And any questions?
What is TID?
Okay, so y'all see. All right, so before you're the patient again, Macy. So didn't check to see if she was the right patient. I'm talking too fast. Okay, so I didn't say, hey, verify your name, date of birth, all that good stuff. I didn't do any of that. All right, so Macy said, what does TID mean? Is that common knowledge? Do most people in the world know what TID means?
No.
You
No.
can't use terms like that. That's not something that your educated people know what that means. They don't know what that means. So I'm sorry, Macy. Sometimes I get in this mode where I just start talking. So I'm so glad you asked me. TID means 3 times a day. You're going to take the medicine 3 times a day.
Okay.
All right. What other questions do you have?
I had another question I was going to ask you that I caught on, and now I don't forget what it was. About the probiotics. What did you say they were for? What
Okay.
what can it cause?
Okay, good. So I didn't even tell her what it was. I just said, you're going to wish you took those. I didn't tell her what it was for. I didn't tell her what anything was for. I just said, ploop, here's all your new meds. Good luck with that. Have fun. All brand new. So probiotics, that's just something that we're going to encourage patients to take over the counter. Sometimes the Flagyl that you're taking, I don't even remember what medicine I told you to take. Sometimes the Flagyl that you're taking can cause diarrhea, and those probiotics can help to restore the normal bacteria that's in your gut, and it'll stop you from having diarrhea. So that's the reason for those.
Okay.
What side effects you could develop? Yes. So I told her about the probiotic, but I didn't tell her sometimes this causes diarrhea. The symptoms, exactly, Abigail. I told her, come back if you have any symptoms. What symptoms? What is she looking for? What the heck? I mean, she's leaving the hospital. She probably has 700 symptoms. So because although I was going really fast and being a little bit over the top, you're in a hurry when your patients are being discharged. You're trying to get them out because you know what? Your nursing supervisor is saying, hey, I got a new admit for you. I got a new admit for you. Hurry, I got a new admit for you. You about ready for that admit? And so you're like, bloop, 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 out. You do have to be efficient. You do have to, you can't like hang out. I'm kind of like a hang out with my patients a little too long kind of girl. That's why I didn't like working the floor because I stayed in there too long and I was always late. But you have to find that happy medium between, hanging out too long, saying all the unnecessary stuff, and being a fly-by-night person and not giving them all the information that they need. So, questions? You did a good job, Macy. I didn't even really give you a chance to talk. Also, give your patients a chance to talk. Follow up with her primary doctor. Yes. So we are going to lay those out. We are going to so what would have been a better way, Macy? Like, let's just start with one medication. One of them I said was acetaminophen, Tylenol. How would you, we all kind of know about Tylenol. So what would be a good way to educate me about that? So now I'm the patient.
Well, like we talked about, it was either yesterday or the first day, like outside of like you being the patient, it's prescribed like related to the patient's condition, right?
Mm-hmm.
So what is the patient's condition?
So let's say I had fever related to an intestinal infection. So I'm taking the Tylenol for fever.
So as a nurse, like I would explain it is an antipyretic, but I would explain that that's a fever reducer to help with the fever. You take it every 4 hours as needed. So if you take it 4 hours later, you feel like you need it again, it's okay to take it. Yeah, that's a pretty common one. Pretty easy to educate on that one. You're muted, Miss Trailer.
Sorry. So all of the things that she said are right. Not saying PRN, not saying, tell them why it's indicated. Tell them when to use it. I would even probably say a temp greater than 100.7 or, whatever, to make sure that they know that. Do you have a thermometer, Miss Macy? Do you have a thermometer at home to even check your temperature? Those are the things that we want to, can you see the thermometer that you have? Can you see it? Can you see those numbers? Or do you have somebody to help you with that? Just taking all of those little things into consideration. Y'all are going to do a good job, but I just want y'all to take all that. Let's see, plus the side effects to look for. Yes. So do you have to go into every single side effect listed? No, you don't. But the common ones, now the handouts that you give them are going to have all of those side effects. But you're really going to just hit the high points. and ensure that they have the literature that supports the rest of it. Okay. Okay, so that was that. Let's trying to decide what I want to do. I don't think I want to give y'all any more information yet, but I can't let y'all go this early, so I got to think about what we want to do. Let's do some chapter reviews. Y'all want to do that?
Yeah.
All right. Let's see. Okay, this goes without saying, but I'm going to say it anyway. The key terms, I do not make you define them, but you need to know them all. Like, make sure if you're a flashcard kind of person, make flashcards. If you are an auditory learner, read them, record them with your phone, and listen to them. Okay. So let's do this. Since we have the time, I'm going to tell you, if I were studying for these chapters, this is how I would study, okay? Not based on what my test says, but based on the best way for you to study moving forward. All right. Go to page. Oh, no, I just remembered something I have to teach y'all. Herbal therapy. We have to talk about herbal therapy. I did not talk a whole lot. I'm back in chapter 1. So we're reversing to chapter 1. A lot of this I am going to be reading out of the book, and I'm just going to kind of stop because I did not include it in my PowerPoint last semester, but I have noticed in looking at the NCLEX test plan and looking at ATI, they talk a whole lot about herbal preparations. So let's talk about that, then we'll do a little review. And I'm talking a whole extra lot today. My throat is like super dry.
What page is this on?
15. Maisie said, it is psychologically proven that using blue highlighters and ink helps one to remember information. Good to know. All those little tips are, take them in, y'all. And because they do all kinds of studies behind all that stuff. Just like writing stuff down, we make you do those templates. Writing stuff down in general, even if you're not a writer, helps commit it to memory. That's why I'm all about building, whenever I say we'll do a little study tool thing later on where I tell you to make a concept map and all that. It's not for everybody, but figuring out something to do with your hands, it will help you. Okay. So herbal medications and herbal therapy are all names for complementary alternative therapies that use plants or herbs to treat various disorders. Individuals worldwide use herbal therapy and dietary supplements extensively. So another little side note, I'm going to tell y'all about my sweet little mama. I wish I had a picture of her. She is I have pictures, but not where I can show y'all. She is probably healthier than me. She's a cutie patootie. She is a herb girl. So we tease her and make fun of her because she will call us sometimes and she'll say, I have this going on, and I have this, and I have this, and I have this, and I'm throwing up, and blah, 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 blah. What do you think I should do? So I'll say, you can ... And she'll say, I got some ginger root. I'm going to try that, and I'll call you back. My lips are swelling, but I'm going to try that first, and I'll call you if it doesn't work. And I'm like, okay, mama. But those are, people are going to use, there is great studies that herbs are effective, and people are going to use them either in conjunction to or instead of their medications. So we need to be mindful of that. We need to know that herbs are frequently used, and we need to know like where they come into play in regards to meds. Okay. So, according to the World Health Organization, 80% of the world's population relies on herbs for a substantial part of their health care. That is solid. That is why we have to talk about this today. 80% of people in the world rely on herbs as part of their health care. They've been used by virtually every culture in the world throughout history. And these are some, I'm going to tell y'all some common ones that I do want y'all to write down that may or may not be on your first exam. St. John's wort is commonly used for depression. Has anybody ever heard of that? That's a common medication, or not medication, excuse me, a common herbal supplement that is used. Let's see what else. Let's see, Native Americans use plants such as coneflower, ginseng, and ginger for therapeutic purposes. Ginger is very often used for nausea and vomiting and stomach upset. Garlic and flaxseed oil are often used to decrease triglycerides and blood pressure. Let's see. Herbal therapy is part of the group of non-traditional therapies commonly known as complementary and alternative medicine. So complementary means they go with, or alternative means they instead of. So they can be given with patients' normally prescribed meds, or they can be given in lieu of. The National Center for Complementary and Integrative Health is one of the 27 institutes and centers that make up the National Institutes of Health. I am on page 15 under that little green heading if you're following me. Let's see. The NCCIH defines CAM as a group of diverse medical and healthcare systems, practices, and products that are not presently considered to be a part of conventional medicine. Examples of complementary therapies are relaxation techniques, massage, aromatherapy, and healing touch. Complementary therapies are often used with traditional healthcare to complement the conventional means. So, patients will often say, if they're prescribed a medication, they'll say, well, can I try such and such first? That's something they need to talk to their doctor about. We don't just need to say, no, that's not an option. Those are complementary therapies that can go with or instead of their meds. Now I'm under that other green subheading at the bottom of page 15. In addition to vitamins and minerals, herbs are classified as dietary or nutritional supplements. Nutritional dietary substances are terms used by the federal government to identify substances that are not regulated by the FDA, but are purported to be effective for promoting health. So the FDA does not approve vitamins and supplements. Y'all all understand that? Let's see. Why is that? It's just not in their realm, Emily. I'm gonna read a little bit more. It's just not in their realm to say, because they're found naturally in nature, so to speak. Like, it's really not for them to say, no, you can't say, you can't take ginseng for nausea. So it's kind of outside of their realm. Because natural products cannot be patented in the United States, it is not profitable for drug manufacturers to spend millions of dollars and the 7 to 12 years needed to study and develop these products as drugs. So people can suggest this, but they're not being developed. They already exist. Garlic already exists, and ginger root already exists. These are not things that are being created. In 1994, the U.S. government passed the Dietary Supplement Health and Education Act. This act defines substances such as herbs, vitamins, minerals, amino acids, and other substances as dietary supplements. This is what I want y'all to kind of pay attention to. The act permits general health claims such as improves memory or promotes regularity, as long as the label also has a disclaimer stating that the supplements are not FDA approved and are not intended to diagnose, treat, cure, or prevent. So there's kind of a little disclaimer on all of these things. That let's talk about lavender. If there's not lavender, what's the other? I think I have one in there. I'll have to go get it. So my daughter, for like 5 years, she didn't sleep. or 6 years, she had eczema really bad, and so she just stayed up all night scratching and like literally didn't sleep for the first 5 years of her life. And I'd taken her to the dermatologist, and we had tried multiple medications. Well, all of the traditional medications that we attempted for her itching and, you know, her inability to rest, they made her like a little zombie. She was like a 3-year-old little zombie. And I was not willing to give those meds to my child, right? And I'm not saying you shouldn't, but it was not a good choice for my child because she couldn't function the following day. So I went to go see a herbalist. I did. I went and I'm like, I need help. I need somebody to tell me. His stuff didn't work either, but that's neither here nor there. I went, they put a little, they swabbed her tongue and did all of this stuff, and they put her on this Calm EZ something at bedtime, and it was like a mixture of melatonin and lavender and, you know, all these little things. That's an alternative therapy. But I did let the doctor know, hey, by the way, she's taken this, because there could have been a drug-drug interaction with the other stuff that he was wanting to give her. There was a reason I was telling you that. There's a reason. Oh, but on the bottle, it says could assist with, you know, could aid in sleep and relaxation. You know, it's not like proven, you know, it's not, there's that little disclaimer. You'll notice those little disclaimers on things. So the claims must be truthful and not misleading and supported by scientific evidence. Some manufacturers have abused the law by making exaggerated claims, but the FDA has the power to enforce the law, which it has done, and these claims have been decreased. Because substances are natural products, many individuals incorrectly assume that they are without adverse effects. So that's what I want y'all to hear. Just because they're found naturally doesn't mean that they don't have adverse effects. I mean, let's be real. Weed is found naturally too, but it can still cause adverse effects, you know, in the people who, you know, who smoke it or whatever. So just because it's natural doesn't mean that it does not have, you know, adverse effects. Where did I read the last sentence from? It is on page 16. Under educating patients about herbs and dietary supplements is the beginning of the second paragraph. All right. So teaching. Everybody needs to be familiar with box 1-2. I'm not going to read it word by word because I know that's getting annoying. But you just need to be able to educate patients taking herbs in the same way that you should be able to educate patients who are taking who are taking traditional type pharmacological therapy. Okay. Okay. Could you type the main ones we need to know? The main drugs? Basically the ones in the chapter. Garlic, I don't know. Let's see, garlic, ginger root. I don't even remember what other ones I said.
Was it St. John Wharton?
Yeah, St. John's Wort, I put that one.
Ginseng.
Flaxseed oil.
Flaxseed oil.
Yeah, I think that's the only ones I said. I think that's it. Okay. Ginseng, I might have said ginseng, yeah. You don't need to know like nitty gritty about those, just what they're commonly used for. You know, what are some reasons that our patients might be on these? Oh, I got another one. Yes, cone flour. Yes, and glucosamine. Anybody know any other majorly common ones? We'll run across them as we're teaching. But those are the main ones. Cranberry, yes, thank you, Macy. Cranberry. Cranberry is used for issues with the genitourinary tract. Glucosamine is used for like bone and joint health. You're going to see a lot of patients taking these. And then I think I told you guys St. John's wort for depression, flaxseed oil, garlic for triglycerides, and cinnamon is used a lot, but I don't actually know what it's indicated for. Hold on 1 minute. I just see a lot of people taking it.
Miss Trailer, you said flaxseed oil and ginger is for the triglycerides?
No, ginger is for like GI upset, like nausea, vomiting. And flaxseed oil is usually used for like triglycerides. I'm looking up garlic because I don't actually know. Let's see. I don't see black cohosh used as much anymore, but all of these are good to know. Let's see.
Don't they use garlic to lower blood
I thought garlic was for blood pressure.
I think garlic is for blood pressure. I'm making sure, and I think cinnamon. I think people use cinnamon for, let's see, alternative. Yes, garlic is taken as an alternative therapy to aid in treating high blood pressure and coronary artery disease. Cinnamon. And so these might not all be on your test, but they're very good to know in regards to just taking care of your patients. Let's see, cinnamon.
What is the coneflower good for, Miss Trailer?
I don't know that one either. I'll have to look it up. Let's see. Cinnamon, digestive issues as well, much like the ginger it says for cinnamon. And let's see what else. Lavender, black cohosh.
Do you want us to know like the bad side effects of it too, or just?
No, I don't need y'all to know side effects. Give me 1 second. Let me go those last two for y'all, and I'll tell you. Let's see. Black cohosh is often used for menopausal symptoms like hot flashes and night sweats. And coneflower, I think, was the last one. But there's so many, y'all.
What was for the night sweats, Miss Trailer? I'm sorry.
The black cohosh. That's okay. The black cohosh. Yes, garlic can cause risk of bleeding. Yep. Coneflower. And there's like a million, y'all. So don't get overwhelmed with this. But it's customarily used for a common cold and upper respiratory stuff, coneflower. So, don't need to know every single one of those, the main ones that I initially mentioned, but I want y'all to understand that you are going to see these. I mean, you're going to have some people who take like 17 different supplements in addition to their meds. So we need to be knowledgeable about the common ones. And if we're not knowledgeable, ask your patient why they're taking it or look it up in the same way that you would medications. Let them know that just because it's over the counter doesn't mean that, you know, too much of anything is not always a good, how's the saying go? I can't get it out right. Too much of a good thing is not always a good thing. So they can't just take it and take it and take it. Robin, you got your hand up?
Yeah, could you tell me what the ginseng was for again? I'm trying to make sure I got it right. Yeah.
I think it's for triglycerides too. I just want to confirm before I tell y'all wrong. Antioxidant and anti-inflammatory effects.
Okay, thank you.
Yeah, I think the ginkgo biloba, I think it does help with memory. I'll look them all up just for Now, don't listen, everybody listen to me. You don't need to know all these. Do not like lose your mind. It's good to know for your career, but don't like go do a full-blown study on all these drugs, okay? Or all these herbal supplements. But it is definitely good to know. It'll help you to be a better nurse by knowing this stuff. And I don't know it as well as I should, if I'm being honest. Let's see. Yes, cognitive. Ginkgo biloba is cognitive. Robin, you have your hand up again, or is that from earlier?
That's from earlier. I'm sorry.
That's okay. All right. So if your patient, now this is what I do know a lot about. If your patient is having surgery, a lot, if you're a surgical nurse, there are so many medications that are contraindicated before surgery. Y'all know what contraindicated means, right? Means no, like no, contraband. So vitamin E, fish oils, all of those can thin your blood. Garlic, like we talked about, all of those must be avoided before surgery. So I have canceled many a surgery when I worked at the surgery center for people taking herbs because they fail to tell you about them because they don't think about them as medications. And then their surgery is canceled that they've been waiting for. So it truly is not just in theory. You need to be aware of these things. You need to actually be aware of these things. Yes, Macy?
I'm sorry, I must have missed it. You said that ginger can also like it's a risk for bleeding with ginger?
No, garlic. Garlic.
Okay.
Yeah, ginger, not really.
Okay.
But like vitamin E, fish oil, all of those can increase the risk for bleeding. Vitamin E, fish oil, and there's another one I can't think of. Okay, somebody else has a question? All right, so just make sure that when you're, you know that they're not, the FDA does not, whatever it's called, I can't think, regulate these things, but there are some acts in place that that do make them, they can't make false claims on their bottles. They can be in charge of that, but they're not, the FDA cannot regulate the manufacture of these drugs. Okay. Yes, ginkgo can cause bleeding. We're going to talk, cranberry, like I said, we're going to talk about those a lot when we get into our meds for the GI tract. So for sure, paying attention to all that stuff. Let's see. Okay. So I'm going to ask y'all some questions. Oh, I was going to tell y'all how to study. Let's take a break. I'm going to go get some coffee. Let's take 10 minutes. Let's come back at 1:22. I'm not going to keep y'all all the way till 3 today. We'll come back. We'll do a little review, and then we'll roll out. That sounds good? So be thinking of your questions for the review. And at 1:23, with coffee in hand, we will resume.
Layla, who was at the door?
Hey y'all, I'm here. I'm trying to get it where I can see everybody at the same time. Hang tight. Because I can only see 9 of you guys.